Hello Enid, I am Diana Hernandez serving you from Garfield County Health Department, and with me I have special guests.
My name's Carrie Reddick and I'm a health equity specialist.
Awesome, so let's go ahead and jump right on into our community health update. And if you want to go full screen, let me go back. I think I jumped the gun there. There we go. Monkeypox has reached a total of 8 cases for the state of Oklahoma. And there's 3 cases in northeast Oklahoma and 5 cases in central Oklahoma. You can go to oklahoma.gov/health for more information on monkeypox. You can also go to Garfield County Health Department Facebook page. We do have this link for easy access. And OSDH has recently released a news release titled OSDH Employee Added to Nationwide List of Work at Health Certified Program Trainers. Work at Health is an initiative of the Centers for Disease Control and Prevention, CDC. It is a free training program for employers to improve worksite wellness with strategies to reduce chronic disease and injury risk to employees. The program provides employer education, training, and ongoing technical assistance to create sustainable evidence-based wellness programs that can reduce healthcare costs and increase worker productivity. Any employer who is U.S.-based, offers insurance, employee of their own can go participate in the program. For more information, you can go to oklahoma.gov or you can contact Karen Lineback at karenl@health.ok.gov. And COVID is still here. The weekly Oklahoma COVID-19 epidemiology surveillance report for July 17 through 23 is now available. You can find that at oklahoma.gov/COVID-19. The new cases 7-day average is 1,482. Active cases for the state of Oklahoma is 20,590. Specific to Garfield County Health Department, for the past 4 weeks, cases 382. And it has been hot. So here are some tips to beat the heat. Drink plenty of water. Check on friends, neighbors, elderly especially, at high risk for heat-related illness. Find air-conditioned places to cool off, like shopping malls and libraries. Never leave kids or pets in a closed parked vehicle. Dress in lightweight, light-colored, and loose-fitting clothing. Limit time outdoors. Take breaks often if you have to be outdoors. Avoid heat stroke and heat exhaustion. And mosquito safety tips. It is mosquito season. It is in full swing, and we want to remind everyone Oklahoma tips to help avoid ailments spread by the insects, including West Nile virus. You can find more information about this at oklahoma.gov. You can also visit our Facebook page, Garfield County Health Department, for more information as well. So, health equity specialist. Now, Garfield County Health Department has programs and services and partners, but today we want to shine the spotlight on health equity specialists. So Carrie's here, an expert, because she happens to be a health equity specialist. So Carrie, for people who don't know, what is a health equity specialist?
That's a good question. Actually, it's important to know what health equity is. I always have to write it down because I can get tongue-tied, but it means ensuring that everyone has the same chance of living the healthiest life they can. However, there are unforeseen situations outside of their control, such as lack of resources or discrimination, or even living in a rural community. So that is where the state and the county has decided to go for funding for health equity specialists to bridge the gap, to go out into our community and be it churches, community members, coalitions, local politicians, to hear the voice of the community and see what Monica and I can do to help. By doing that, we build new relationships. We want our county to know that we're more than just vaccinations or COVID, because we've heard that so much, and I think people are they need to know that we're more than that. Which leads us into different resources that we provide to the community. It could be anywhere from new windows to help with utility bills, and by networking and building relationships with outside governments or outside independent companies, we build relationships with that where they actually help our community. Just today we went to the groundbreaking at the Leona Mitchell water improvement, and that was really exciting because you don't realize how important it is when you don't have running water. That's extremely important. By building our relationship with the community, we thrive. United we stand, divided we fall. So,
now, is there resources like housing that you can connect individuals with?
There sure is. I started a list years ago, and I add to it where there's hundreds of resources, and I share it freely with whoever asks. It could be anywhere from mental health, utilities, help with housing, or if you're behind on your mortgage. I mean, by going to coalitions and other nonprofit meetings, we find out information that we disperse into our communities, and it does help. It is helping.
Now, do you have any partners when it comes to employment, or do you know how to connect individuals who need recently lost their job or can't find something suitable?
There are different services. It just depends on the situation. And we have community health workers that I need to plug that to, that they actually follow our community, our clients, to see how they're doing, to see what other resources we can help them with. But they do help find resources as well for job displacement. We want to keep people and families intact. So the state has decided that this role will help with that by getting the word out to see what we can do, because there are resources out there. We just have to know the situation of the client at the time.
Now, would you think that one of the resources is the Mobile Wellness Unit?
Yes, it is, and it's needed. It is needed, especially with people. We know that transportation in rural communities, specifically we've heard in Garfield that, transportation as a whole in Oklahoma, we are rural. There's not really a metro like there are like in other big states like New York or Washington. So we have the mobile unit that actually comes out to our communities. They provide an array of different services. It's not just COVID vaccinations. They do WIC appointments, women exams, and they're drawing labs now. So that is an option to go. We have it at specific places and times. We send referrals in weekly, and they actually go out in the community for a day or that time, and they provide the services that community needs.
Do they do sports physicals? Do they partner with schools?
Great. I'm glad you brought that up. Yes, they do. We do partner with schools a lot. Our nursing staff is amazing. And they actually will go. They're going to Burlington, the beginning of this month, and they will be there for a day. And they go to Gary. They'll come here. We have 2 vans and 1 fifth wheel, so they do physicals.
Awesome. I think they were actually at Enid High a couple of weeks ago, and got quite a few, and also bus drivers who needed physicals too. So
good.
That was really neat. So to contact, if you are having a local event and you would like to partner with the Mobile Wellness Unit, you can contact, well, the contact information is there, but if you want to know of upcoming events, you can visit our website calendar. We have constant, which is great, need of the Mobile Wellness Unit out in the community. So there is no exception. Concerts, partnering with schools, churches, public health is for everyone because it involves everyone. So it's leading Oklahomans to prosperity through health and literally public health on the go. So the phone number is on your screen if you want to contact and partner. We will totally be happy to do that. 405-212-8425. And we would love your feedback. We want your feedback. And in many ways, we need your feedback to kind of better our services and programs for our neighbors, for the people that we serve, for the heroes, creating strong and healthy communities and families day in and day out, everybody, which is everybody, the public. So, Carrie, what is the health assessment for?
What it is we are asking our community some demographic questions. It's all confidential, private. We're asking our members what they need, what their leading causes of health disparity is. If there's so much that you don't realize goes into it. So it's an open format for them to speak what they need. And we're hoping from getting the information from our actual community of making health equity changes. So, I mean, it's important they have a voice, and we want to be that voice.
And what I like about this survey, it's really quick. It takes literally 5 minutes, but it has some reflective questions, like what are barriers that are limiting us from living a healthy life. And sometimes it really makes you think and self-reflect, and is it cost of food? Is it housing? Is it resources? Transportation. And it's very in depth, and so it covers a wide array of things that all have to do with health.
It does. It all ties in together. Just from what we've gotten since we've started doing this survey, we found out a lot of information, but we want to hear more so we can make educated decisions by the feedback that's very diverse for these surveys.
All right, so say I am a viewer and I'm like, I want to look into this health equity specialist because I might have a need and I think that you might be helpful in that. How can people contact you?
You can contact us by the information on the screen right here. That's my mobile and our office. Monica Smiley's as well. She's my peer and we do the same thing. We always say, please don't be nervous. There's not a silly resource. There's nothing to be embarrassed about. I mean, everybody's gone through their trials, but if you need help of any kind, please reach out to us. That's the only way we can help. There's nothing too big or too small. We just have to work on it.
So if it's like a mom needing diapers or assistance with formula, if it's a homeowner needing a window replacement, or if it's someone who recently lost their job, need help with the
domestic violence, anything, it runs the gamut. Like you said, windows all the way from domestic violence, about to get your house taken away. I mean, it could be anything. And we're here to help with no judgment. Just offer help and see what we can do.
Thank you, Carrie. And so Garfield County Health Department is a wide array of programs, services, and resources. And we have health equity specialists just like Carrie serving the Garfield County Health Department. So please reach out to us. We are located at 2501 Mercer Drive here in Enid. You can call us 580-233-0650 if you have any more questions for myself or Carrie. And we're on Facebook. Find us. We put out information there, and that's where you can find the health assessment survey and take it. 5 minutes. You help us to help you and everyone. So like us, share us on Facebook, and that is it for our community health update. We'll see you guys next month for another community health update, and stay cool. Do you have any wrapping thoughts?
If you need COVID vaccination, COVID kits, call me. I can bring them to you.
Awesome. A plethora of resources. Thank you, Carrie, for coming on here. And thank you for watching, and we'll see you guys next month. Thanks. Bye.
Bye.